It's still one of the most prevalent diseases around the world, as tuberculosis still infects millions of people worldwide. Over the weekend at the Hyatt Resort, the Let's Unite End TB in Guam conference happened. TB Program Manager Chima Mbakwem.
The conference is basically to refocus our island healthcare professionals to continue to think about TB after COVID-19. With the statistics that were and the data that was presented today, it's obvious that we're seeing a decline in TB cases in the world generally. But there's a question about, is it a true decline due to interventions that are going on, or is it a decline due to the effects of COVID? And also, is it a decline based on the fact that we are underdiagnosing TB and underreporting TB?
Speakers at the conference sharing his knowledge on what he knows about the disease.
I spoke on two topics. The first one was I gave an overview about TB in the US, in the Pacific Islands, and in Guam. And we did a comparison to show what the cases are and also look at the cost of treating TB and also the cost-saving measures that the Public Health Department has in place to treat TB. And then the second one is leveraging our partnership and involving stakeholders in our aim to drive TB down in Guam.
Another guest speaker present at the TB conference was TB nurse consultant Nadia Sabwala, who shed light on what she spoke on at the event.
Talking about leveraging partnerships and stakeholder involvement. TB anywhere is TB everywhere, and so it's important that we work together to eliminate TB.
Sabwala is also part of the National TB Controllers Association, where their goal is to provide support to all the different TB programs in the states to move toward the elimination of the disease.
The second talk is about multi-drug resistant TB, the new and emerging treatments. The old treatment for multi-drug resistant TB was sometimes 18 months, sometimes 24, sometimes 36. There's a newer regimen, which is only 6 months, and so I'm going to be talking about the nursing implications when we use that treatment for our TB patients.
The conference also had experts that spoke on TB diagnosis, latent TB treatment, and new cutting-edge science in place for TB treatments and diagnosis. Daniel Perez reporting for KUAM News.